Hi, David Liew here for a room now from EULAR 2025, the last day of the meeting. Usually the last day of the meeting is quite sedate. Today was jam-packed. I just want to tell you about a poster from the poster floor today about hidradenitis suppurativa. And I think this is a disease which, by virtue of having therapies that might be appropriate for it, is something coming to the fore. I don't think we realized it existed as much before, but now we're starting to realize that it's much more common than we appreciated previously. And actually, it's coming to us a little bit to care for because it's a lot to do with our therapies. We know that TNF inhibitors some TNF inhibitors have been appreciated to be effective in hidradenitis suppurativa, and increasingly it's IL-17 inhibition, which has really been the focus. So there's really interesting poster about trying to understand with hidradenitis suppurativa, is there an inflammatory arthritis underneath? Especially if you think HS is part of a SPA spectrum. Um, is it related to inflammatory arthritis? We know it can happen sometimes. Well, actually, the long and the short of it is German study looked at assessing objectively you're using ultrasound and then uh, fluorescence optical imaging as well, a little bit fancy, to try and pick up whether there was actually any difference in terms of the underlying inflammatory arthritis between HS and PSA in healthy controls. And actually, HS is even more in the inflammatory arthritis bucket, according to this study, than psoriasis. So, in fact, we find more inflammatory arthritis in this small cohort study. Now, whether or not it's at the same extent, whether or not hidradenitis suppurativa has the same risk of inflammatory arthritis as psoriasis or not, I think is clearly a point for contention, but does raise a question that hidradenitis suppurativa is not just about the skin. And we need to be starting to think about the manifestations. We know that for any of these diseases, the manifestations don't always move in synchrony, in perfect synchrony. Just because you control the skin doesn't mean you control the joints. And it's worthwhile us thinking about that with HS. As we take over a bit of that care, or certainly involved in that care, and we deal with patients with joint pain, trying to understand whether they're inflammatory or not, it's worthwhile us thinking about how we go about assessing patients with HS and potentially thinking about whether different mechanisms of action might deliver different outcomes for the joint involvement of HS. So, plenty more IL-17 related throughout the Room Now coverage from day one to day four. Go and check it out. You know where to go. RoomNow.com.